Thank you, Mary, and good afternoon, everyone. Very warm welcome to this month's cafe about bladder health. I'm so glad to see so many people interested in this very important topic that is often ignored and not talked about. For those who I haven't had a chance to meet yet, I'm Laila Kaikavoosi. I'm the clinical lead at Online Menopause Center. And I'm delighted to be joined by Peony, who's the founder and CEO at Jude. Jude is a healthcare company who has a mission to spread the word about bladder health and to improve bladder health via a variety of ways, research. They introduce and research products, and they have a really good supplement, which Peony will talk about a little bit later on in this presentation. So we'll get going. Many women start to experience bladder symptoms during perimenopause and menopause transition, but they're usually very quiet about these symptoms for a variety of reasons, which I'll go through a little bit later. And they sort of accept it as their new norm, and it doesn't need to be that way. There are lots of positive things that you can do, and there are many treatment options available, which we'll spend today to just go over them so that you're better informed about what the possibilities are. We'll talk about the common symptoms of urinary tract problems and the different types of incontinence usually women encounter during the time of perimenopause. And of course, the all-important treatment options, which Peony will help me with the Jude side of things. And there'll be plenty of time at the end with the Q&A. But if you have any questions, this is an informal chat and presentation, so please feel free to stop me and ask any questions on any slides that you may have. So just to get started about some common symptoms of bladder during the time of menopause. The first one is actually needing to pass urine more frequently during the day or night, which can disturb sleep as well. This is called urinary frequency. Some women experience pain on passing urine, a symptom called dysuria. And of course, the all-important, common and often embarrassing symptom of leakage of urine or urinary incontinence, which is quite common at perimenopause and menopause. It's even more common with aging process and for those who've been childbearing or having gone through childbirth. There are two main types of incontinence that we encounter during perimenopause: urge incontinence and stress incontinence. And I'll go through each one in a little bit more detail in the next few slides. Other symptom that I often see during, in menopause consultations is frequent episodes of cystitis or urinary tract infection, which is really disturbing for women. I wanted to spend a little bit of time to just go over the anatomy of pelvic organs, because I think it helps us understand what the relation of these organs are to one another and how symptoms of one can influence the other one. So if we just look at this is a cross-section of a female pelvis. This is the bladder where urine is stored and the tube where the urine flows out, the urethra. Just behind it is the uterus and vagina, and just behind that is the rectum. And so, it's easy to see how for women, for example, who have chronic constipation, that can impact their urinary symptoms as well, and it can make it worse. So you may be told, for example, if you suffer with chronic constipation, that we need to deal with that in dealing with the urinary issues as well. But like most of our organs and cells, these organs are also fully covered by the hormone receptors, estrogen, progesterone, and testosterone. And with the fall in estrogen level, the tissue and the muscles start to weaken in the pelvic area. And as you can see, the close proximity of these organs means that they are sort of working as scaffolding for one another. So if one shrinks in size or is weakened, it does influence the other organs. So for example, during menopause, we go through vaginal atrophy, or the actual size of the uterus can also change and shrink in size. That affects the neck of the bladder and the angle of it as well, and it can result in a number of different symptoms. So there's less support for the bladder and urethra because of the, the support behind it with the uterus and vagina has dropped. And this can result in involuntary leakage of urine or urinary incontinence. Urinary incontinence is surprisingly really common. It affects about half of all adult women, and it increases in frequency to about 75% of those above the age of 65 are affected by it. It reduces quality of life, and I'm sure anyone who experienced these symptoms knows about these. It negatively impacts people's social, psychological, and physical well-being, and very few people seek help. There's, as I said, there's many different reasons. One is embarrassment. The very common issue is that people don't like to talk about urine symptoms or urinary leakage. They consider it to be a normal aging process, and many people have no idea about the different treatment options. So they may think, why should I discuss this with my doctor when they can't do much about it? I just have to wear a pad and put up with it. So I think that's where we want to change the sort of way of thinking, and because there are many treatment options. The two main types of incontinence that menopausal women encounter are stress and urge. So stress incontinence, if you look at this picture here, this is the bladder. The two tubes are the ureters bringing urine from the kidneys to bladder where the urine is stored. And then this is the urethra, that is the outflow of urine from the bladder to outside. There is a sphincter right at the outflow of, at the outlet of the urethra. And then the pelvic floor muscle acts as the other sphincter on the outside. So these muscles, the sphincter and the pelvic floor, help to close the urethra so that there's no involuntary leakage of urine. What happens in stress incontinence is that the sphincter and the pelvic floor have been weakened. So the urethra remains slightly open. And so if there is any pressure from the abdomen, that results in leakage of urine or incontinence. Urge incontinence is, let's go. Oh. Urge incontinence is actually quite opposite of that. So it's also known as overactive bladder. You may have heard of that term. And it's a sudden and intense urge to pass urine. And sort of you really need to rush to the toilet as soon as you have the urge to pass. Otherwise, there will be a leakage. And there is an increase or overactivity of the muscles that contract the bladder, and that results in the bladder, or you feeling that you need to empty your bladder, or that your bladder is very full when in fact it's half full. And the pelvic floor muscle and the muscle of the bladder contract involuntarily, and that leads to an urgent need to pass urine. Vaginal dryness, another very common symptom at menopause, and extremely important when in the context of talking about bladder health, because of, when I explained about the close proximity and the anatomical proximity of these organs to one another. As estrogen levels decline, vagina, vulva, urinary tract, all of these organs become dry and thinner and shrink in size, something called vaginal atrophy. And these are organs that are naturally, for their function, they need to be a bit moist. So when the moisture goes and the tissue becomes thinner, you can have symptoms like even spotting or bleeding from the vagina, and also resulting in painful sexual intercourse, which results in reduced sexual activity and changes to the pelvic floor muscle tone. Bladder and urethra also suffer when there's reduction in estrogen levels, both directly because they also become smaller, weaker, and shrink in size, but also because of indirectly because of the fact that the gynecological organs have changed in size and they've shrunken as well. And that can result in an urge to frequently and urgently pass urine. There's an increased tendency to have cystitis or urinary tract infection. So women who complain about vaginal dryness, but they say maybe I should just leave it because I'm not sexually active or I don't mind, you know, I always encourage them to actually address that and to get rid of that symptom, because it puts them at higher risk of developing frequent cystitis, urine infections in the future, and which is very inconvenient and very difficult to deal with. It can also, you know, dryness can also cause irritation and itchiness, which especially in the context of, you know, workplace, and that is difficult to manage. We do have, you know, different treatment options. The very first one and the most important one, I guess, is the pelvic floor exercises. Strengthening your pelvic floor muscle through exercises can really help improve the bladder control. And you really need to get professional guidance here, because it's very difficult sometimes to stick to these exercises, because they, you know, you have to do them on frequent basis during the day, and you have to stick to them on long-term basis. So anything that, you know, there are many different ways to engage with someone who, and that's why it's good to get that professional advice, and if you really want to engage with that process of pelvic floor exercises. Lifestyle modifications are really important. There are some foods that irritate the bladder more so than others. They're like alcohol, caffeine, or spicy food. And of course, maintaining a healthy weight, because the more pressure from abdomen that is on the pelvic organs, the less likely to control the urine outflow. And of course, quitting smoking for those who are smokers, both because it increases it's a better blood supply to the pelvic organs, including the bladder, urethra, but also it reduces the likelihood of increasing the abdominal pressure by coughing, etc. Hydration is a strange one, because it's counterintuitive, and a lot of people feel that, you know, when they have some, you know, urge incontinence or even stress incontinence, they actually avoid drinking water, because they think, you know, that will make me want to go more often. But in fact, it's really, really important to keep hydrated, and it's really important to make sure that the urine is not too concentrated, because it becomes even more irritant to the wall of the bladder. There are good supplements, which Peony will talk about shortly. Vaginal preparations are really good. They can really help restore vaginal moisture and elasticity. And for many, this can actually really help with improving the bladder function and continence. There are many varieties of them. So there's creams, rings, and tablets. And then there are pessaries that can be inserted higher up vaginally, which actually works even better for some more significant incontinence problems. There are estrogen pessaries, you may have heard or use Vagifem. Also, more recently, there's a DHEA pessary. DHEA is an adrenal hormone. It's a cell regenerator, and it strengthens the tissue in the pelvic area. That pessary is now available even on the NHS. It's called Intravosa. And usually these you only use them daily for the first couple of weeks, and then after that you can use them as often as twice a week, or as infrequently as once every fortnight. There are compounded vaginal hormone preparations. Compounded means that it's bespoke, tailor-made for individual women based on their symptoms, their history, their blood levels. And we can combine estrogen, testosterone, DHEA, a number of hormones in that. And for some people who may have an allergy to this manufactured vaginal preparations, or they may they may want to avoid one or the other hormone, this could be a good option. Also, medical treatment, the obvious one is hormone replacement, which is the thing that basically lacking of hormone kickstart all of these problems. So replacing the hormones is a really good option, but of course it's not feasible for everyone. Some people don't want to take a systemic HRT, and some people can't take it. And just going back to the vaginal preparations, they're really good in these. Vaginal estrogen is a great treatment, actually. for most women, even those who are either unable to or don't wish to take a systemic HRT. There are also medicines that can help with relaxation of the bladder. So that's for people with urge incontinence. Some of the names, I've left them on this slide: oxybutynin, Vesicare, or even Botox more recently has been used. These are known as antimuscarinic medications. They do have side effects, and the main ones are dry mouth, constipation. Sometimes they can make you feel dizzy. Also, there's specific antidepressant like duloxetine that is really good for increasing the muscle tone of the urethra. So that's where the problem is with stress incontinence. So that's for people when they leak, if they laugh or jump or exercise, or even during sexual intercourse. So this is a medication that can be used, but of course, like any other medication, it's not without its side effects. And then there are a number of surgical procedures like vaginal tape or mesh or urethral bulking agents, or a procedure called colposuspension. But for those, you need to speak obviously with urogynecology and see if it is a suitable option in your case. I'll now stop and hand over to Peony, who will tell us about Jude.
Thank you very much, Laila. I started with this slide because I actually also had a UTI that lasted for 10 years, a cystitis, since I was 14 years old. And that is one of the main reasons that it motivated me to start Jude. And I was, really on a track to understand my root causes and understand the triggers. Dr. Laila just now talked about, the different kind of bladder irritants, also talk about hydration, because it is so counterintuitive. And the timing of the hydration actually is quite important as to how you want to, improve or relieve some of the symptoms, especially during nighttime, if you're waking up at night and going to the toilet. So knowing that my symptoms are UTI, urge incontinence that combine together, I want to try and pinpoint what kind of food and what kind of drinks I drink that might lead to some of these symptoms. Also, how many times I'm going to the toilet, that I would be able to infer what is actually might be a trigger for my symptoms. So we have a Jude sort of 3-day bladder diary on our website, free to download. It is a very useful tool for yourself, but also your GP, to be able to make a faster diagnosis or give you advice and treatment faster, so you don't have to wait another appointment for that to come to you. So always recommends our community to do a little bit of a diary and a log. Laila, next slide, please. So I was talking about how I had that UTI that lasted for 10 years. So when I was young, I really imagined the future of bladder health. I don't know whether anyone knows about this Willy Wonka story, but actually now there aren't a lot of options really available, or the awareness of that option is really low. And Dr. Laila also talked about pads have been, I suppose, used to normalize these symptoms. Dr. Laila, next slide, please. Exactly. And instead of using this as a short-term solution whilst we're trying to address the root causes, pads have actually been used as, for many, many women, 10 years, 15 years, a long-term solution to cope or manage the symptoms. And so this is one of the big reasons why I started Jude, because I want to offer varying different options for women to take care of their urinary health, their bladder health and pelvic floor health in a slightly different way. Next slide, please. So before going into the supplements, there are a lot of tips. I think it is very easy that you can start today that will make, some symptoms relieved quite quickly. So there is a right way to pee. When I was about 20 years old, I self-taught the right peeing etiquette. So what we call elbow knee wheeze is the right way to pee. Put your elbow on your knees, feet firm on the ground. That way you can actually empty out your bladder fully. because if residue urine sits in your bladder after your sort of first toilet run, that could irritate another urge. And then if you find yourself, gosh, I need to go to the toilet again just 20 minutes after I needed to go, if you want to try this kind of peeing posture, it would help you to manage some of that urgency. When I was young, I was taught to practice just in case wee, and I know it's difficult not to do it, especially if you also have frequent urge, but I would recommend listening to your body natural cues. If you don't really need to go to the toilet, avoid these just in case wees. Reason why. We have a brain and bladder connection. And so if your bladder is full, what it does is it sends signals to your brain, and your brain asks your bladder to sort of empty out the urine. But if you're doing a just in case wee, what it sort of really means in reality is your bladder is probably half full or not really full at all, but you go anyway. So over time, that really condition your brain to tell your bladder to empty, even if it's not full. And that could lead to urgency and overactive bladder. So start by reconditioning or retraining your bladder. That could really help with urge incontinence or overactive bladder. The third one is go with the flow. You know, some women probably would either push really hard to get all the urine out very quickly, or sort of stop and go again. So I would say, again, sort of listen, let your body decide, like go with the natural flow. That's the really best way to let your pelvic floor relax as well, as you're going. So 3 very easy tips that you can do, hopefully in an hour's time or 2 hours, in your next toilet kind of run. Next slide, please. So now we want to talk a little bit about the Jude supplements. We know from the slide that Laila talked about, there are bladder irritants such as, you know, caffeine, diuretics, citrus food, but there actually are bladder superfoods as well. When I was younger, I made a lot of adjustments in my diet, and I appreciated the impact over time that it has made, not just to my urinary health, my UTI, but also overall my pelvic floor health. Dr. Laila just talked about the importance of estrogen and how, you know, our bladder and our pelvic floor actually need estrogen too. Some women want to look for that estrogen from their natural diet. And that could come from soy, that could come from, you know, other sources of food. What we put as part of our formula in our supplement is a soy-based isoflavones. What they do is they can help replenish some of the lost estrogen and really go into the areas around your pelvic floor and your bladder. And what is really good about this soy, the extraction method of the soy is patented such that it really goes through your gut and go to your bloodstream and goes to area that really needs it. And the outcomes of it, it can help repair some of the pelvic floor tissues, the elasticity. You know, when we look at the anatomy of the pelvic floor organs, those tissues can be a little bit more plump, if you want to use that word. They also help support the muscle bulk for bladder control. So that sort of bladder lining is a smooth muscle, and actually they have estrogen receptors too, and then help support a healthy rhythm of contraction and relaxation. So estrogen, massively important, and you can tap it from your natural diet, but also HRT or vaginal estrogen. Another really interesting ingredient comes from seeds. This seeds in particular is from pumpkin seeds. This very simple, quite unassuming seed is actually a bladder superfood. They are really rich, naturally rich in zinc, magnesium, and a lot of minerals, antioxidants as well to support bladder relaxation. They have actually been considered in Europe for about 30 years, a traditional remedy in the EU monographs for relieving overactive bladder. Our supplement uses the maximum dosage that is considered as a medical dosage for relieving overactive bladder. So each daily dose contains about 71 pumpkin seeds. And so, of course, you can go and take 71 pumpkin seeds a day, and hopefully that would give you a similar way of absorption into your bloodstream. But our supplements just make it easier. a lot more accessible for you to do so. Sorry, Laila, can you go back to the last slide, please?
Sorry. I think great.
Yeah, and what it also does, it help increase the nitric oxide levels in your bladder to help relax your bladder too. So next slide, thank you. So this formula that we use have double-blind, placebo-controlled, randomized controlled trial to back the evidence. So over 12 weeks and 90 days is clinically tested to support women to regain bladder control. So 9 out of 10 women saw visible results in a clinical trial. And the outcomes is 66% fewer bladder leaks, 70% fewer toilet visits at night, and it really helped you relieve that need to go urgency. And it's this paper, SHIM 2014, which you can see the RCT. Next slide, please. Thank you. So we work with, of course, Laila and also, a panel of gynecologists, urologists, and a Harvard medical professor who specialized in functional food to develop and also sort of back our evidence as well. We currently already are working with Southampton University Hospital, Manchester University Hospital, the London Bladder Clinic with JSAT, the Amara Clinic with Anne Henderson. She's also one of the 200 selected British menopause specialists in the UK. The London Menopause Clinic and Mila Health to spread the awareness of women can tap some of these benefits from their diet if they choose the right supplements to go for. Next slide, please. So how to take Jude supplements. We recommend 3 tablets a day for the first 2 weeks, which is what the clinical trial you can see in the SHIM 2014 paper recommend, and then 2 tablets afterwards. Take it daily. It is a habit. Imagine if you're doing your pelvic floor exercises. It's a similar, I suppose, habitual formation or going to the gym. And 86% of participants in this clinical trial saw an improvement in 12 weeks of taking Jude formula daily. We see some questions in the comment box. I can definitely address it afterwards, or I can address it now. A lot of women say, I'm taking HRT, can I take the supplement? So there are currently no research showing there's any contraindications, but I'll always go back to your doctor and ask whether that is suitable for you, because everybody is very different. And then we'll see if there's another slide here. Is that the end of the presentation?
Yes, it is. That was really good. Thanks, Peony, for that. I think it's really useful to talk about the different options available, and often, as during a consultations, a woman asks me whether I know a good product or supplement for a variety of symptoms. There's so many in the market that it's difficult to know which is suitable for what symptom or what they should be taking. So that's why I was really interested to find a really good pure supplement for this purpose, because some women actually just want to take HRT or a localized vaginal preparation only for urinary symptoms. They don't have many other symptoms of menopause. So and for those who can't take systemic HRT, or they don't wish to take it, it's a nice option to have a food supplement.
Exactly. Well, thank you, Laila, for having me here today.
Yeah. I don't know whether, Mary, have we gone through the